Hello and welcome to Financial Considerations. My name is Melissa Long, and I'm the Director of Education and Support at Insight Memory Care Center. Our mission is to provide specialized care, support, and education for individuals in all stages of memory or cognitive impairment, their partners, and the community. And our vision, a community where those living with memory or cognitive impairment and their care partners can achieve the highest quality of life. We're the leader in dementia care in Northern Virginia, and happy to say it's our 40th anniversary this year. We've been supporting families on their dementia journey since 1984. We provide care with a specialized adult day program for people in all stages of their dementia journey. We connect by building relationships and supporting care partners on their journey. And with creativity, our dementia experts can share their knowledge and resources because every journey is unique. This evening, we have the pleasure of having Arvette Reid, who's a client services director at the sales and marketing professional for more than 20 years. She spent over 15 years in the senior housing and healthcare industry, where her tenure spanned through the range of independent living, assisted living, nursing care, dementia, and hospice services. This spectrum of industry where her tenures, I'm sorry, her experience is now unique, informing her current role as Client Services Director with SEIA, a Forbes 100 wealth management firm, where she is working for the Thomas West practice and breaking new ground with the Life Care Affordability Care Act plan, a pioneer service that bridges the gap between senior health care services and financial planning. Arvette brings the financial and healthcare world together, making a powerful impact in serving family holistically. Thank you for being here and welcome.
Thank you. I'm very excited for tonight.
Good.
All right. So you ready for me to share?
Yeah, go for it.
Okay, great. I will share my screen now. Okay. Well, welcome everyone. I'm super excited to be doing this presentation for you. And I'd also like to share that I am a current board member for Insight. I'm a very proud member and all the wonderful things that Insight Memory Care Center does for so many families. So let's get started. So a little bit about myself. I'm born and raised here in Alexandria, Virginia, so I'm local to those of you who are in the DMV, as we call it. I'm also a very proud University of Virginia grad. And as was mentioned, I worked in the senior housing and healthcare industry for 15 years. So during that time, I was the marketing person working with families directly who were trying to make decisions. So I did independent living, assisted living, memory care, nursing care, and hospice throughout those 15 years. So 7 years ago is when I joined the finance firm SEIA. And as we mentioned, Tom West, we mentioned him in the bio, he is a financial advisor who has been very well respected in the Northern Virginia and DC area, DC and Maryland area, for understanding the healthcare and financial interaction. So what he did was invited me to join the team so we could figure out how to do a better job of taking the healthcare world and the finance world and bringing them together and helping families understand how to make better informed decisions. But I also like to share a little bit about my personal story. So 2 months after starting my new job, my mother became ill after a surgery that went bad and ended up dying 18 months later. So here I am, new job, wife, mother of two, and working along with my father and my brother who was out of town trying to figure out how we were going to navigate this journey with my mom. On top of that, within the first year, my father-in-law, who lived in a 2-acre home, my husband is from the country, decided to move to a retirement community, which was local to us. So I was very happy to get him closer because I was the one going up and down 95, trying to make sure that he got what he needed when he needed. So I like to share my story because when I talk to families, I'm actually looking at things through 3 viewpoints. First of all, I'm a senior housing and healthcare professional. Even though I worked there 15 years, I'm still very active in that industry. So over 20 years working with senior housing and healthcare professionals. I'm also now a finance professional, so I am licensed. I am a financial advisor. But more importantly, I'm an adult daughter. I'm an adult daughter who went through this with my family as well as with my in-laws. So one of the things I did when I joined the firm 7 years ago is I said, all right, I need the financial professionals to explain to me what financial planning is. So my mother was a social worker at St. Elizabeth's Hospital in DC for 20 plus years. And my father was a middle school principal for 20 plus years. So we didn't grow up talking about numbers and finances and investments at the dining room table, right? So this is what I call your typical planning timelines. For those of you who have interacted with financial professionals over time, these are the conversations you're having. What are your pre-retirement goals? As that means, what are you saving for? Whether you're saving for a college education for a child, or whether you are saving for a vacation home, whatever it may be you're saving for in additional to retirement. And then when you retire, what are you planning on spending on, right? How much do you think you need to live off of? Are you going to stay in your current home? Are you going to move across the country closer to your family? Do you plan on traveling around the world? What are your plans so that we can make sure from a planning standpoint and a financial standpoint, we're making sure you have the money to do the things you want to do? And then lastly, your legacy. When you die, what do your estate documents say and where do you want your money to go? How are you going to share that money? These are your typical financial planning conversations, but we're not going to talk about that today. What we're going to talk about is this. This is what I call the updated planning timeline. You know why? Because all the healthcare stuff happens right here after retirement. So right in this space is exactly why Tom asked me to join the team, because of the disconnection between finance and healthcare. So let's talk a little bit about healthcare. This visual I know is a lot, but I wanted to put it out here because I wanted to show you all of the options that are out there in the senior housing and healthcare space. So I describe it this way, like you're walking along, you have your life, you're living your life, and then all of a sudden your loved one gets diagnosed with some form of dementia, right? And then there's this door that opens, you walk through and you enter a whole universe of things you've never heard about, you don't understand, there's a language that they're speaking, you're trying to navigate. And this is a visual of what you're trying to navigate. And just from perspective, like down here, adult daycare, this is where Insight is, right here, adult daycare. So we're going to expand upon this a little bit later, but I wanted to make sure we were all on the same page about the vast number of options that you have. Here are some stats. 70% chance of needing long-term care after the age of 65. Right? So 70% chance that someone's going to need some help after 65. And that's with or without a diagnosis of dementia. And the average number of years is 3 years of long-term care services. 3 years. So when people are talking about planning in general, these are two stats that we like to tell people, like, just start with these. But if your loved one has dementia, then this goes out the window because you're going to be planning possibly for way more than 3 years. If they have Alzheimer's, which we know the life expectancy of that, compared to maybe like Lewy body. So this is part of the understanding how the finances work is also understanding the diagnosis, which we'll get into a little bit later. So I want to set the stage too about Medicare. So remember, I was the marketing person that was meeting with families to describe the services that were being offered. I was the one that had to tell the families, I'm sorry, this is what Medicare covers. So you can see this is actually the report from last year that comes out from CMS down here. So Medicare is a federal benefit. It is a federal benefit that you either qualify or you don't, right? So you qualify it for or you don't. These are the things that Medicare traditionally covers. Doctor's appointments, if you go to the hospital, if you're on hospice, if you go to your prescriptions, you see this skilled nursing facility. If someone needs rehab, so if you go to the hospital and you're there for 3 nights and you need to get rehab, whether it's in home or at a community, that's typically covered by Medicare for a short amount of time, right? But what you don't see on here is long-term care spending. So I was the one delivering the news to the family that I'm sorry, your Medicare benefit is not going to cover these services that we're talking about, all right? Let's jump to Medicaid, because then people say, oh, I'm going to plan on using Medicaid. So Medicaid is a state-run program. So Medicare is a federal program. Medicaid is a state-run program, and it's a financial assistance program. So if you need to learn more about Medicaid, I know that Insight has webinars on that specifically, but I wanted to go through it today because I know some of you in the audience have either been told by family members, an attorney, or a friend, or you're thinking, I need to look at Medicaid and hiding my loved one's assets, right? So what I like to tell people about Medicaid is if you are looking to qualify someone for Medicaid, there are 3 eligibility factors. The first is medical. They actually have to have a medical need, right? So traditionally, the medical need is some kind of nursing level of care need. It may be some kind of assisted living need, but it gets really gray when someone has dementia, but everything else is okay. They're walking, they're eating, they're talking, all of those things are fine. It's just that their mind and their cognitive ability is declining. That's not necessarily a medical trigger to qualify for Medicaid. People also like to talk about the income factor. How much money are you getting per month from a Social Security, from a pension, wherever it's coming from? There's another threshold that they're going to look at, and that's the income. And then the last threshold is the resource. That's where people fall into the house, right? So you have a house, but if you have a second house or if you own other property, all of these things are going to be considered when you're looking at Medicaid, right? So I'd like to tell families the first thing you need to do when you're thinking about Medicaid is you need to understand what around you offers Medicaid. For example, in Northern Virginia, there is one assisted living that takes Medicaid. One. That's it. There are plenty of nursing homes that take Medicaid. So then I would ask you, go tour the Medicaid nursing home, because the places that you might have in your mind that your loved one may be able to go might not be the really nice fancy place that you have in your mind. They might not take Medicaid. The other part of it is some people are like, oh, well, I'm going to stay home with Medicaid, which is an option. Medicaid does have the waiver aides that come to the house, but they don't come to the house for 24 hours a day. They come to the house for a given number of hours. So what I like to remind families is if you're going to go this route, you still need to have a plan of who's going to cover the hours that Medicaid is not going to cover. They may cover 4 hours or 8 hours. Who's going to help the rest of the time? So I'd like to put this out there because people are thinking, I'm just going to go the Medicaid route. And I wanted to make sure you understand that there's a lot of things that have to be thought through before you make that your plan. So let's talk a little bit about COVID. The shortage is real. During COVID and after COVID, there's an estimated 250,000 nursing professionals left the industry. They left the senior housing and healthcare industry. And although the numbers are coming back and we're getting more people, we're not getting the experienced people. There are a lot more new, younger people that don't have as much experience. And I will tell you that the industry is fighting over the same resources. So whether it's a home care agency or whether it's a large community, they're all trying to hire the same caregivers, right? Because it is a shortage. I think this is really important because before COVID, people who had a lot of assets and a lot of money could literally buy the care they needed and they didn't have to worry about it. In today's world, it is much more difficult because everybody with money, they're still fighting over the same resources and competing with the communities who are able to offer 401ks, benefits, and vacation, right? So I like to set that stage too. So with just a little bit of background, one of the things I want to get into this home versus move conversation, right? So your loved one has some kind of diagnosis of dementia, and you're trying to figure out what does our life look like from this point forward. And it's this ongoing push-pull about, do we stay home or do we move? And I'm sure everybody around you has their opinion about whether you should stay home or whether you should move. So one of the things is I want to go through this through a financial lens. So first of all, 91% of the people want to stay at home. We know people want to stay at home, right? But you have to remember, sometimes home is not an option. So you're most hopeful to stay home. But just because 91% of you want to stay home doesn't mean that that's going to be the safest option for your loved one that's been diagnosed with some form of dementia, okay? So here are some numbers. If you are planning to age in place with your loved one who has a diagnosis, then you need to plan for the cost of bringing in home care. So we're just going to jump right over here to this 24 hours a day. So from a financial professional perspective and a planning perspective, I tell clients that this is the number we're going to plan for 24 hours a day when your loved one needs that. All right. You'll see here there's a live-in. So I get a lot of questions about the difference between the live-in and the 24 hours. The live-in is someone that can move into your home if you have a space for them. But don't forget, they need to sleep, they need to eat, they get breaks. So the question is, who does the work and watches the person while that person's on break, right? So a live-in is definitely an option. 24 hours a day means there's someone in the house 24 hours a day, usually 3 different shifts. Down here on the 4 hours a day, why this is important is because maybe you don't need 24 hours. Maybe you just need a break, right? So maybe your loved one is going to Insight, to Reconnections, which is the early stage program, or maybe they're going to a day center a couple days a week. But maybe on the weekend or some other time, you want to be able to go out to lunch with your friends. Let's say you have a standing book club on a Saturday, and you want to hire somebody to come stay with your loved one every Saturday for 4 to 8 hours or whatever while you run your errands, you go to your book club. You just need to know, like, an average cost for that is $35 an hour, and you need to start budgeting for it. So this gives you an idea of like bringing care into the home and how much that costs. But if you're planning on your loved one aging in the home, there are other costs that you need to be mindful of. Number one is the home accessibility renovations. Everybody talks about these, the grab bars in the bathroom, the fact that you might need a ramp to get into the house, those kinds of things. So yes, there are lots of organizations that are around that can help with that. Home maintenance services is something I also tell my clients to start thinking about. So if the person diagnosed with the form of dementia is the person that's changing the light bulbs in the house or changing the filters in the heating unit, as they age and as the dementia progresses, they're not going to be able to do that. So who's going to do it? Some people will rely on their neighbors or their children that may live close by. But what I like to advise is now's the time to build a relationship with a handyman service, right? Because if you build a relationship now with that handyman service, you learn to trust them, you get to know them. And as your loved one declines and you as a caregiver are focused on other things, that person coming into your house, it's not a new person. So I like to tell people start budgeting for that earlier than later. Number 3, the home generator. So we're in an area, well, sometimes the power goes out. We don't have a lot of snowstorms. We don't have a lot of hurricanes right here, but they do come. So get the home generator now and use that. You know why? Because you're going to need the home generator to run oxygen, and also if someone's on a CPAP or BPAP machine, sorry. So we have all heard stories where someone goes to the hospital like this and comes back on oxygen. So we like to advise people, get the home generator now and just use it when you need it occasionally, but it's also there when the emergency happens. You don't have to run around and scramble. These last 2, visiting physician and care management services. Visiting physician, back in the 50s, everybody remembers the doctor walking around with the black bag doing home calls, and then it kind of stopped. Well, during COVID, there was a surge. They started doing it again. Some of them were private pay, but now there are a lot of visiting physicians that will come to the home and bill your Medicare. Why is this important? As your loved one continues to go through this journey and continues to have decline cognitively and age, we all know it's harder and harder to get them out of the house to get to a doctor's appointment. So I like to encourage clients to build a relationship with a visiting physician now who gets to know you as your general practitioner, who can come to the house and be that guide in the house, right? Obviously, you won't be able to replace your specialist. You're still gonna have to go to your neurologist. But having a general practitioner that can come to the home is very helpful as your loved one continues down this journey. And the last one is care management services. I don't know if you guys have heard of that. I call them the hidden gems of the industry, so much that I've created its own slide. So here we go. Care management services. They're also known as aging life care professionals. I call them the consultants of the industry. So remember the diagram with all the colors and all the different options and that universe that you were trying to navigate? They're the ones that really understand the ins and outs of the industry. Sometimes they're also described as adopted daughter. So for example, if you're listening and you're an adult child and you're not living in the same location as your parents, one of the things I tell adult children, maybe they should consider hiring a aging life care professional in the town or near the town where their parents live, because that gives you eyes and ears as to what's happening, right? So the reality is, if your parent or parents are somewhere far and they're telling you over the phone what is happening, they're not always going to be the best narrator of what's happening and what they're hearing at the doctor's appointment, because there's a lot going on. Sometimes if dad has dementia, mom's just trying to remember how to eat lunch. So going to a doctor's appointment, they're only going to walk away with a piecemeal, right? So care manager would be good in that case. They tend to be social workers or nurses. So either or tend to have those certifications. And I like to tell people, this is their website at the bottom right here. And you can do a zip code search on this website to find the ones in your area. There are some great care management services agencies here in the DMV, and Insight will be able to guide you towards some if you want some. Okay, so we talked a little bit about staying at home. How much does it cost to bring care in? What are the other things I need to think about that are going to cost me money that are not going to be covered by my insurance? So now we said, look, I want to stay home 100%. That is my goal. I want to stay home with my husband. I want to stay home with my spouse, whoever, my mom, whoever it is. But we also need to plan for the what if. What if home is no longer an option for whatever reason, right? I want you to understand what the types of communities are out there and how that financial model works as well. So here's a simplified version of that crazy diagram I put on early on, right? So this is the cost. As the level goes up, the cost goes up, right? So this is the level of care and this is the cost. And so you can see the more help a person needs, the more you pay. So all of these can be individual places. They could be individual standalone buildings, right? All of these are options for you anywhere along the journey. But when we talk about long-term care services, remember the stat I gave you, 3 years for normal kind of average person, most likely longer than that for someone with Alzheimer's diagnosis. This is what we mean by long-term care services: assisted living, memory care, and nursing and rehab. All right, so that's the terminology. So now that you understand the terminology and the places that are available to you for your loved one, the question is, when do I move them? If I move them at all. I want them to be at home as long as possible, but I might have to move them. So do I move them before another event? All of you know something happens. That's what I call an event. Getting a diagnosis is an event. The first time you got the diagnosis and you heard the diagnosis, that's an event. Since then, other things may have happened. There may have been a fall. Your loved one might have gone back and been reassessed by the neurologist, and their cognitive decline is decreasing. I mean, it's getting worse, right? That's an event. You went away and they got lost and couldn't remember how to get back to the hotel room. That's an event. So when you have an event and then you're in your new normal, that's the time to maybe say, okay, if something happens again, are we prepared? Are we ready? Or is it time to maybe make a move while we're stable? The other side of that is maybe your loved one was just in the hospital, 10 weeks ago, for example. And now you're like, that was a lot. They can't navigate the house very well. I think after this last traumatic event, it's time for us to look at moving, right? That might be the time. If you both want to move, right? So there's a question about, do I stay home? And does my loved one go to a memory care? Or do we both move? So I encourage people whose loved ones are in the early stage of a diagnosis to at least think this through, because moving together means that your priority is staying together. If your number one priority is staying together, then you need to consider moving together as opposed to staying home as long as possible, and then your loved one might have to go to memory care. Because if you wait and your loved one has to go to memory care, there's no way for the two of you to be together in the same location. I hope that makes sense. So let's explain how that works. If staying together is the most important thing to you, staying at home is the most important until I say, is staying together more important than staying home? If staying together is more important than staying home, then that's when you can look at different community types. So in this case, this is what we call the life plan communities, or the CCRCs that you might have heard of. And these are the ones that have all of these levels of care under one umbrella, right? So sometimes they're in one building, sometimes they're on one campus, but the theory is they have all of these options for you so that you can move together into independent living as long as you move early enough. And as your loved one progresses with the dementia, they can stay with you. You can bring in-home care. You can still bring in home care if you move to one of these places in your independent living, or you stay in your independent living and then your spouse or loved ones moves to memory care, right? You might not be in the same location as far as apartment or villa or whatever, but you're on the same campus and you're close by, right? The other part of this is that when you were together in independent living, the community gets to know you as a couple. So even when your loved one moves, it's okay. They still see you as a couple and they're still checking on you as the caregiver in independent living. That's just how the vibe works. There's also what we call the senior living community. Let me go back. I forgot to mention here, typically these life plan communities are the ones that charge the entrance fee and then the monthly fee, right? So that's one of the things to remember. The entrance fee and monthly fee are typically the life plan communities. All right, now let's talk senior living. Senior living, you notice, does not include nursing. So there are a lot of communities that have popped up over the last 7 years, 10 years that have independent, assisted, and memory care, and they're typically just a monthly fee structure. So once again, you can move in together and independent, and then if ever your loved one needs to move to memory care, they can move, right? So let me give you some examples of when moving together might make sense. If you live together right now, and your loved one is a walker and likes to go on walks around the neighborhood, and all of a sudden you're noticing they're walking out the door and you're watching, they're getting down to the street and they're stopping and they don't know whether they should go left or right. They're starting to forget their walk pattern. So that would be an example of, do I need to be concerned that this person's going to wander out? We've all seen on the news the horrible stories. This is what I encourage you to talk to people at Insight, get some kind of assessment to figure out if your loved one is safe at home. That is a perfect example where home is no longer an option, and moving to one of the type of these communities might be what's best for you and your loved one in the long run. Okay. Here are some pricing structures for assisted living versus memory care versus nursing care. Most people with dementia diagnosis will go straight to memory care, right? But there are cases, if you're a couple and you're older, maybe the both of you can move to independent living or assisted living together and see how that works. But assisted living, memory care, and nursing are 3 separate stages in that senior housing process. And these are just give you some ideas and numbers, all right? So I told you how much you need to plan for 24-hour home care. Now I'm telling you how much you need to plan if you're looking at the other levels of care. So where do we start? So I tried to give you a lot of baseline, some background to put everything in perspective and all your different options. The first thing you have to do is you have to make a plan. And you have to make a plan based on your new reality right now, not what you thought things were going to be 5 years ago or even 2 years ago. Here's an example. Let's say you're an adult child and your mom or dad lives alone, right? And you know they've been diagnosed, but they seem to be doing okay. They still want to drive. They still want to do these things. But the reality is we know they are going to decline, and it is not going to be safe for them to be by themselves in the house at some time. So your plan now should be, what do we do with mom or dad if they get another decline in their cognitive ability, if they have a fall, if they have a hospitalization, right? So that's the new reality with the diagnosis. Also, you need to write it down. You can't have a conversation in your head or with your friend or with your sister about what you think you want to do, or even your parents. Your parents might be, your mom might be early on in the diagnosis and can articulate what she wants. Like, there needs to be family discussion. You need to write it down. And then you need to share it. Everybody needs to share it. So I told you earlier, I'm an adult daughter. I had opinions about my parents, about my mom. And my brother, my dad, myself, and my aunt, because my mom and aunt are very close, we all talked about it and we all came up with a plan together. That is very important. Some of you are dealing with this as a couple and you are not including your children. And what's happening is your children are in the background worried about you and wondering what you want and wondering what the options are. And they're going to start coming to you with their own opinions because they're doing their own research. It's really important to have family meetings so that everybody is involved in these discussions about what you want, what your hopes are, whether you want to stay home, whether you want to move. Getting into the deeps of the financials is up to you, right? It's your money. You decide if you want to share the financials. But at a minimum, you need to share the concept of staying home versus moving and what is really important to you so that they know. And I'll also say one more thing. A lot of adult children will jump in and say, I think you should move closer to me, right? Families live here. I had a client who lived here with her husband. Her husband was diagnosed with Alzheimer's. The daughter lived in Colorado and kept insisting that they move to Colorado. So I was talking to the client. I'm like, do you even like Colorado? And she was like, I don't want to move to Colorado. Well, then, all right, you're not moving to Colorado. So you have to be able to have these conversations openly and not be afraid of hurting your adult children's feelings by saying, this is what I want for me and your dad, and moving to Colorado is not one of them. I also want to give a little plug for Insight. So there is what we call the Share Plan, and it's a program that actually is offered by Insight. So if your loved one is in the earlier stages of the dementia diagnosis, this is a great way to start with someone and talk through these things with a third party to get these things written down. So anybody at Insight can help you learn more about the Share Plan.
And Arvette, I just do want to throw a plug in there. We currently do have a waiting list, but that doesn't mean we can't see you. It's just going to be a little bit of time. So I just want everyone to know that.
Yeah, and it's amazing. It's not expensive. And on the other side of that, you get, it's such a great process, such a great process. So we've talked about the importance of having a plan in place. I'm also going to talk about the importance of having a team in place. When you are dealing with planning and changes and how do we get ready for the future, a well-balanced plan means that you have three-legged stool, right? You need to have your legal documents updated. You need to have a medical professional that's telling you what's happening. And then you also need to have a financial professional in your life to help bring the numbers together. So all three of these work together to help you take the steps along this journey. Now, it would be nice if everybody could hire professionals. If you had money to hire professionals, that would be great. Sometimes it could be an adult child who is financial, right? And that can help you with your budgets and things like that. It also could be the county. Sometimes the county has services for it. So I don't want you to feel like you can't access professionals because you feel like you don't have money. There are resources out there and all kinds of different avenues to get this going. So legal documents, very important. That's a whole nother topic and a whole different webinar. Medical could be the care manager that I mentioned, the aging life care professional. They could be that medical person that's helping communicate with the finance and the legal, and everybody is on the same page, right? That might be a good person for you to put on your team if it makes sense. So now let's dive into the financial side, right? Now that I've set the stage. The question I get all the time is, where am I going to pull this money from? Like, I don't understand. I need to start getting care for my spouse. I would like my mom to participate in the day program at Insight, but I don't know where the money comes from. This is why you do a plan. Planning first. People want to go straight to their portfolio, their investments, their 401ks, their TSPs, wherever their money is. But I'm telling you, that's not the important thing. That portfolio, that investment strategy should be driven by all of the other financial pieces in your life, right? So the portfolio strategy is determined by the plan first. So what do I mean? The real question about finances is income. It's about your cash flow, not just your assets. So here's an example here of how you build that up. Do you or the person with the disease have Social Security? Do they have a pension? For those of you that have IRAs, you're well aware that you have to take your required minimum distribution at a certain age every year. That's considered income, right? Some of you may have long-term care insurance. If you have long-term care insurance, I suggest you pull out your policy and write this down. You're going to call your insurance company and you're going to ask them for an in-force illustration. In-force illustration. What that will do is give you a snapshot of the long-term care policy benefits right now. How much money do you have and how much can you use, right? And if you don't have long-term care insurance, don't stress. If you do have it, I just need you to know it doesn't necessarily cover everything. It's just one other source of potential income if your loved one is at the qualifying stage. The other thing on here is survivor benefit. So if you have a couple and one person dies, that's what we call survivor benefit. So usually pensions, may or may not have a survivor benefit. And it's pretty important to understand whether that's there. And then you might be getting a regular interest rate, interest income from your investments, right? So this might represent some of the things in your current cash flow. So now the important thing is to understand, what is the cost of care? I've given you some numbers to target. $300,000 a year if you want to stay home, $145,000 a year for memory care, right? This is the cost of housing and care. This would represent, this is my cash flow, but this is my gap. This right here is what the portfolio needs to do. So if you have a financial professional in your life, going to them and saying, my husband's moving, I need money, they're going to need to know, well, like, what do you need and how much? This is what the portfolio needs to generate so that you can cover whatever costs you have. Now, you have issues that may be going on today. We all know that as things progress, the cost of care is going to go up. We assume a 6% increase in care services every year. And the amount of care that someone needs is going to go up. They're going to need more hours at home. They're going to need more days at Insight. They're going to need a higher level of memory care, whatever it is. So you also need to plan for those future costs. So the portfolio needs to do this lift today, but your professionals in your life, your financial professionals, should be helping you plan for when the portfolio needs to do this lift, right? So that's why I say it really is about income and what the portfolio needs to do. The income and the costs drive the portfolio strategy. The other thing is, what happens if someone dies? We talked earlier about survivor benefit, right? So there are some cases where the person with the disease has the pension. And so you're talking about mom and dad, or you and your husband, or you and your spouse together, and the person with the pension dies. How much is left over for the surviving spouse? You have to know that number. So if you're planning to move together before the diagnosis continues to take the memory away, then you need to confirm that when the person with the pension dies, that the surviving spouse still has enough income to stay wherever you decide to move, right? So I like to say, when we do this process with our clients, our process is, first, we understand your reality, which is what I'm telling you. Make a plan based on your new normal, your new reality. Then build the scenarios. Are you trying to stay home? Are you trying to move? Have you looked at the places you want to move to? How much do they cost? Do they have an entrance fee? Don't they? And then you have a plan of action based on the gap that I told you from the income coming in versus the cost of care. When you go through this process, I promise you, you're going to like drudge through it. You're going to have to dig up papers. You're going to have to find stuff. But when you're on the other side of that, you're going to appreciate it. So this was a survey that we did with some of our clients who have walked through this process. So before, they were completely overwhelmed, anxious, worried, like, are we going to be able to afford this? And when I say that, it doesn't matter if you have $5 million or $50,000. Everybody is concerned about being able to afford the care for their loved one, as well as making sure they have enough to take care of themselves for the rest of their life, if you're a couple, right? After you go through this process and you go through this planning and you dig up these numbers and you do this analysis and you figure out what assets you have, you are going to feel confident and better prepared for the options that are coming. So once again, nobody's telling you what you have to do, but you need to plan on all the different paths. If you want to stay home, fine. Think that through. What does that mean? If you think you want to move to a community together, great. Think that through. What does that mean? If you think you're going to stay home together as long as possible, but you know your spouse may have to move, think that through and know the pricing and know what that means. And if you go through that exercise, I promise you, you will feel calmer, and it will lower your anxiety about some of the financial piece of what's coming, because there's a lot of unknowns coming. So the more on the financial side that you can get organized and get your arms around, that's one less thing that you have to be worried about. So here are some tips on navigating that maze. Obviously, Insight is an amazing resource, right? So thanks again to them for inviting me to do this. So use their website, go to their classes, get as much as you can. Other options are the Positive Aging Sourcebook. So these are free publications. We're very lucky that this started here in Virginia by a gentleman named Steve Gurney. So he also has a lot of webinars and stuff as well that some of you might have seen. And they have a website. Here's the website. I'll tell you, I think the hard copy book is easier to navigate than the website. So you can go to the website and order a free book and it'll be mailed to your house. Also, I think Insight might have some books. Any communities that you have been talking to, like if you've been going to seminars at a memory community or something, like, they all have books. If your loved one goes into the hospital for some kind of reason, the case managers at the hospital have books. So they really should be almost everywhere. You can also contact your local area agency on aging if you're not in this area of the positive aging source book. So I have clients all over the country, right? So sometimes I will say, let's call the area agency on aging and get from them what their resources are. If you are here in Fairfax County, for example, I mentioned the aging life care professionals. Remember, I told you their website earlier. Fairfax County has a thing called ElderLink. And within ElderLink, they have care management services. So if you live in the county, you might be able to access their care management services at a reduced fee, depending on how your income and assets lay out. So I like to share these because these are great resources to start learning about this big number of options that you have, as well as narrowing down some of the things that you really want to consider for your family. Oh my gosh, what happened? There we go. Oh, are you still there? There we go. Can you still hear me?
Yes, we can.
Okay, good. My computer did thing. So here's the most important thing: having a plan. How many times have you heard me say plan, plan, plan? But having a plan in place really does help. And I would like you to please read the bottom with me. When you have a plan, your family doesn't have to wonder, worry, or disagree. Because the professionals that work in this space will tell you there are a lot of families that start fighting in times like this. And part of it is because you're not communicating. The more you communicate, the more you talk these things through, the more everybody feels heard and respected, and you can move through this journey together as a family. So it's really important to make planning a priority in your life. Okay, I am done.
Perfect. Does anybody have any questions? While we're waiting for questions to pop up, please feel free to put them in the Q&A. You can look at any of Insight's further opportunities on our education website. Next Tuesday, we have Dr. Paul DeRye talking about the new Alzheimer's med that was just approved with the CDC. So you can do that. And then the first week in September, we have our talk about all the new Medicare benefits this year, which is really important to know. All right, our first question. Oh my gosh, I love your energy and knowledge.
Thank you.
Can you address the childless couples solo seniors? Is that Arizona?
No, that's a great question. So let's talk a little bit about solo seniors. Some people call them solo agers.
Mhm.
Those are people who maybe have never been married or are a widow, or maybe their children live far away. So one of our clients, she's here in Northern Virginia. One child lives in Japan and one child lives in Germany. So essentially, she's what we call a solo ager. It is very important for solo ager, if you've never married, no kids, your legal documents are very, very important. Back to the planning, your legal and your financial. So if something happens to you, who's the first call, right? And it doesn't have to be your niece that you don't really talk to that much, right? And you don't have to pick a friend. Attorneys could be the first call. Care managers could be the first call. So solo agers, like, I really encourage you to start reaching out to professionals and asking the question, like, what should I be thinking about, right? And then also there's another part about partners, no kids. Is that what you said?
Yeah.
Yeah, same thing. The two of you can be each other's, but as soon as one has a diagnosis, like, that goes out the window, right? So if the two of you and one of you has a diagnosis, the person with the disease can't be your POA. So you're in the same boat. You have to, like, relook at everything and come up with a brand new plan to make sure that you're set.
And there are some life aging care managers that can be your medical power of attorney, and you can use them for legal. So you have that option as well.
Yep.
Suman wants to know, how can I qualify for Medicaid that is not income based?
Well, there's 3 criteria for Medicaid. All 3, they're going to look at all 3. So anybody who is questioning whether they are Medicaid eligible, I would go to the county that you live in, whatever county you live in. I would go to that county, to that Medicaid office, and get the paperwork and talk to them. They are great resources. You can call them, you can go to the office, you can listen to webinars. But I would start with the county that you live in to get the information.
Yeah, and we're actually going to have one of those presentations in October specifically to help with that piece, so keep an eye out for that.
Yeah, and I think one of the important things about going to the county is because you are going to hear a million different things from all these other people.
Yep.
This attorney says this, my friend said this, attorney said this, my church member said this. Like, I would just don't listen to the noise, go straight to the source, to the Medicaid office itself.
Lynn would like to know how you access VA benefits. So we actually have a whole resource on our website for that, because the VA's presented for us. Arvette, do you have any other feedback on that?
Yeah, I would say for me, it's kind of like Medicaid. People are thinking Medicaid or Medicare, Medicaid, and VA benefits are going to be their saving grace for paying for these things. And the reality is they're not.
Yeah.
They're just not.
Yeah, the PACT program with the VA will cover up to 20 hours a week of care. And Insight is this close to being VA certified, but you can use those benefits at home for a caregiver as well. But all that stuff's on our website under resources, so you can look there for that.
And just remember, all those things stack up. It's just one of the things you use to help cover the cost.
Yeah. Susan would like to know, can you please give that term for what you ask your long-term care company to provide in form?
Yes, in-force illustration. In-force illustration. They'll know exactly what you're talking about. Just call the number and they'll send it to you. They'll mail it to you.
Martha would like to have you comment on long-term care insurance, its strengths and challenges.
So if you don't have long-term care insurance, that's a whole different conversation, right? Because the long-term care insurance industry has completely changed from what it was 20, 30 years ago when you got insurance. So some of you bought private policies from like John Hancock. Some of you got policies through your job, maybe through the federal government. So in general, we tell people keep your policies. I know the prices are going up every year and people are thinking about maybe not paying and cutting their benefits. Like in general, the rule of thumb is keep your policy, because if you, especially on the person that has the diagnosis, you know they're going to need care. You know it's coming, right? So you're going to be able to check it, activate that policy with the loved one with dementia, and then start getting that income.
And the other thing I tell people with that are that a lot of people want to wait till it's the worst moment to start using it, and then it's too late and you don't use it. Yeah. So don't think that way, because you want to use what you paid for.
Yes, and this is another example with the 3-legged stool. If you have a medical professional in your life that's helping you through all this, they can remind you and help you and say, yes, it's time, don't wait. So a care manager or even the people at Insight, they can all get you to the point where you realize it's okay, put it in. Let's start getting the money now.
Yeah, exactly.
Don't worry about saving it for later, as you said, just use it.
Jean would like to know, if you move into a retirement home, then one moves into a dementia care at the same facility, does it cost double?
Good question. So it depends on the community. There's a whole different presentation on contract types. So depending on the community, you may be paying 2 monthly rents, one for independent living and a higher one for memory care, right? Certain types of communities, type A's, that's a whole nother thing. They are the ones that as you move to the level of care, the monthly fee does not change. So there are some, what we call type A, continuing care retirement communities out there. So when you move into independent living and your loved one needs to go to memory care, everything stays the same.
Perfect. Do you know if Veteran Affairs helps with long-term care and assisted living?
There are some assisted living that will take the VA benefit. Yes, it's income to help pay for. But once again, you really need to deep dive into how to apply, how to get the benefit. Like, you need people to walk you through. So you need to follow up on the webinars with Melissa and Insight to get that process.
Yeah, we can help you with that. And they'll be speaking again next year, but they won't let us record. They left us all of their PowerPoints and all of their stuff. So we're more than happy to share that with you, and I can answer some questions.
Yeah. But I also want to be honest, like I've dealt with a lot of clients who thought there were a lot more VA opportunities and places around than there actually are.
Correct.
So we need to set the expectation. Like there's just not a ton, and it's not always an easy process, but you just have to be patient and let the professionals help you through that process, and you'll be okay on the other side.
Yeah, in this immediate area, North Virginia, we would be the only adult daycare that's certified. There's one nursing home that's certified. So yeah, it is very slim pickings.
One. So I said there's one Medicaid nursing,
Yeah.
I mean, sorry, one Medicaid assisted living in Northern Virginia, and she just said one nursing home for VA certification. So that's not an easy thing.
No, it's not.
All I'm going to warn you is don't rely on that to be the income source to pay. It's just one of the income sources that you have access to.
Ella would like to know, do you recommend working with a lawyer to review a memory care contract before signing it?
Oh, this is a good one. So we do have a lot of clients who are just really leery about these contracts in senior housing and healthcare. It's a whole industry that has been around for a very long time. In most cases, they're not going to change their contracts, right? But if you want somebody to review it just so you feel better, do that. But I will tell you, I've had clients there who cannot find an attorney who wants to review their continuing care retirement contract, right? They're like, oh, we don't do that. So it's important to understand it. If you have somebody that can help walk you through, I just want to set the expectation, like there's no redlining in any of those contracts.
Yeah.
That's not going to happen.
Do Insight daycare expenses qualify as a tax-deductible medical expense on your federal income tax?
Great question. So medical deductions, huge part. Like as soon as you use any kind of service that's licensed as an assisted living or up or home or daycare and up, you can write off. And Insight will tell you exactly how that works for them. So yes, you will be able to write that off on taxes as medical deductions. Now remember, the way medical deductions work is you add them up for the year, and there has to be a certain percentage of your income and all of that. So your accountant and somebody can help you do that. So don't just think just because you're at Insight, you're going to get this huge tax break. It has to add up to a certain number based on your income for the year.
Perfect. Thank you. Thank you. Great presentation. We're in hospice care at home. But I don't have a big plan for what happens if home no longer works for us. I'm planning to stay home as long as we can. Should I plan an alternative? I guess it could be dicey if something happens to me as the caregiver.
Oh gosh, caregiver stress is real. We all know it. We've all seen it. It's a real thing. So having a backup plan if something happens to you is very important. But also, like you said, if your loved one is at home with hospice, hopefully hospice will be able to give you the resources that you need and point you in the right direction. So that's a good home versus move conversation. Like, do I bring in more care in the home to make sure that my loved one is taken care of properly? Or do I look at moving them somewhere else outside of the home? Like, both are options. There's no right or wrong. You just have to figure out what's right for you and your family. But talk to the professionals to get some of those answers. And back to what happens if something happens to you, your legal documents need to be up to date.
Yes, that's hugely important. Make sure you have someone who can take over that role.
Let me tell you, if you have a financial professional in your life, let them read the drafts of the documents. If you go to an attorney, it's really important that you go to an elder law attorney that specializes in this space. Because we will tell you, people have documents drafted. And I'm not saying these attorneys are bad. I'm just saying some of them have specialties that others don't. And so your financial professional will read through and be like, okay, we're not going to be able to use this because of this language or how this is checked or not checked. So just have a financial professional in your life, double check the drafts before you sign off on them.
Yes, very good point, because there's a couple banks that will not take them.
Yes.
Last one. Thank you so much, Arvette and Insight. Best program on this topic we've ever seen. So helpful. Will we be able to have access to the PowerPoint slides?
We are not going to give out the PowerPoint slides, but this is recorded, so you'll be able to watch it. And then we are going to give some blog posts to Melissa to follow up on some of the things we talked about today.
Perfect. All right. Well, I think that is I don't see any more questions. Thank you again, Arvette, for this. We'll try and get the recording up by the beginning of next week. And for all of you that came tonight, we truly appreciate it. And keep an eye out for our next presentations. I hope you all have a wonderful evening.
Thank you.
Bye.
Bye-bye.